Nurses are the largest group of health professionals in this country. But as the largest group of health providers, they had the very least to say about health care policies. I see nurses being far more concerned about the prevention of illness instead of the treatment of the illness. And I think if we're really going to solve the problems of the healthcare delivery system in this country, we've got to put the emphasis on prevention. And that's what nursing service is all about.
Now use your hand. Just use your hands. Spread that around. See, just very often you can use your hand with the baby, again, touching the baby. Now, isn't that fun? If there's a man and a woman in the home. Now, I am now working in community nursing, having health teaching seminars, getting feedback from them on what their nursing needs are.
So I was so worried because I got two, and if I get pregnant, nobody's working.
You see, the public right now is begging for nursing care, not medical care. More medical care and disease-oriented care will not help the public. Nursing focuses far more on health teaching, teaching you to care for yourself.
What hurts is going through the skin, not going into the vein. So it's better if you go through the skin kind of quickly. You'll feel a give as you go into the vein, okay? And the first thing you do when you get into the vein, what will happen is blood will come back into the tubing here, okay? Then you release the tourniquet, okay?
We used to sit in the waiting room for, one time it was 2 hours before we could get the medicine. Because I have hemophilia and I need to have certain medication to stop the bleeding. When the bleeding goes into the joint, it wears away the bone, and if it keeps on going, I'll be crippled. But now that I can give it right away, I can stop it right away. So I'll have a better chance of not being crippled.
Now feel it so you know what you're going for. Now which way are you going to go? Okay, you don't ever go that way. You always go this way, towards your heart from wherever you are. Okay, that's what might make it a little difficult here as opposed to here. Okay, you want to go there. It's fine. You'll be able to do it.
Yeah, I'll still go there.
Can you see where you're going because of the shadow of your hand?
Yeah.
Okay. Keep going a little steeper. Oh, fantastic. Okay, now, that's right, take that and put that down right there.
Now, can you pull out more?
Very good. Fantastic. That's just great. You're going to have no problem. That is really good. People with chronic diseases, right, require little curing. They really don't need that because you can't cure them. We can't cure cancer today, we can't cure diabetes, and we can't cure heart disease. But what can you do with them? You can maintain their high level of health, which is preserving their wellness. So I would say that it could be a safe assumption today that young nurses are looking for more than to just care for the sick, but are really looking to make a significant contribution in the healthcare system.
When all of us graduated, we really expected that we were going to have control over our work to a certain extent. And basically, we all found that we were just running around like crazy people, unable to control anything, any part of our job.
And then combined with the sort of, malarkey we gotten in school about, total patient care and being involved with the patient and looking at every aspect of the patient. And, you were damn lucky if you could get their bath done that day, and if you worked on a weekend, you knew someone was getting a urinary infection sitting in that bed of shit, but you just had to get your pills out to everybody because people need their digoxin. It was like setting up such priorities that you really felt like you were barely being a human being, let alone a nurse.
To me, a professional is somebody who basically controls the way they perform their job. I think about doctors and lawyers as being professionals. And I don't feel that nurses have any control over their job. We don't control patient care. We don't control the amount of staffing. We don't control anything about who gets admitted to the hospital, who we take care of, how we take care of them. We are a group of 15 or so RNs and LPNs who work at many different hospitals around the area. We got together about 2 years ago when some of us had just started working as new graduates. Working in the hospital really pits nurses against the patients because we don't have enough staff, we don't have enough time. We start seeing each patient's needs as an intrusion upon our already crowded workday. The patients are pretty powerless. So a lot of times, you think, well, gee, this patient is making a reasonable demand, but it's going to upset a lot of red tape. And I know they're right, but I can't satisfy their needs because, after all, who sends me my paycheck? It's the hospital. One of the problems is that we only see that the only solution is to get at ourselves, to get a better job for ourselves, to get into an easy floor, or to go back to school, or to go out into the community, which is this mecca to a hospital nursing. And I kind of like working in a hospital. It would be nice if I could see a change, and if I wouldn't have to leave after 3 years because I was so fed up.
The turnover rates in the field of nursing, nurses leaving hospitals because they're frustrated, is probably about 60 to 70%. Nurses, as we know, are striking throughout the country. They cannot get the conditions in which they can actually practice.
I've never worked with a contract where decent working conditions were set down, or where my rights were established that if I wanted to have input into change, there was a mechanism.
I sent in our first list of the kinds of proposed changes we wanted June 13th, 1973, which was a whole year before we even went on strike.
And more than a year
And
before
more,
that.
because
that
that's
actually started about 8 years before, in 1966.
You were the only one of the group, Joyce, who was, in this group who was there.
Right. The most, I think, impressive thing in my memory about 1966 was walking down the hall one morning at 7 o'clock to hand in some 100 RN nurse resignations. So people were willing to throw their whole job away in order to get hospital administrators just to talk with them. They wouldn't speak to us about anything.
I mean, I was just starting nursing school in '66, but I was talking to the nurses, and I was in Nebraska then. I heard about those crazy nurses in California, and I'm going, I don't know if I could ever get involved in a strike, because what about the patients? I mean, there are those poor people there that we are dedicated to take care of them, Never in my wildest dreams, number one, did I ever imagine I'd ever be in California, and number two, that I'd ever participate in anything so outrageous as a nurses' strike. In '74, I was one of the crazy nurses.
The administrators who do the staffing at the hospitals, you probably know this, they have a staffing coordinator who I don't think has been on one of the patient wards ever in his or her existence. At our hospital, the director of nurses hadn't been on the wards up until the time of the strike. And they don't know what's happening, so you have these administrators sitting in offices making very business management kind of decisions, which are basically life and death decisions for the patients. And for us, it's a matter of, working under really miserable conditions and not being able to give people what they need. And it's extremely depressing as well as scary. Very frustrating, exhausting. There's not enough nurses to do what should be done for people who are in those hospitals.
First of all, you're a professional nurse, so you can't be an employee. Then you realize, well, I have to be an employee to have some security so I can act as a professional nurse. Otherwise, I can't stand up and say, look, we need 3 more of me here to do the job that needs to be done. In March of '75 at convention, it was the first time that there was rational discussion about nurses participating in collective bargaining at a strike and all of those other dirty things that nurses don't do. And there are still nurses that don't believe that we should have been involved in any way in what we did.
This is what you say. Oh, you can't scare me. I'm sticking to the Union. I'm sticking to the Union. I'm sticking to the Union. Oh, you can't scare me.
I find
name is Linda Vandercook. I'm on the negotiating committee. And, I was told to call because you were having some problems and some questions or some doubts that was causing you to think about going back to work. And I was wondering if I could help you because I know it's been very difficult these last 5 weeks. We've all been under a lot of pressure and everything, and, we're having a lot of financial problems. I know myself, I have 2 children, and I have to support them myself. Yeah, and I know it's difficult, and I know the holidays are coming, but I'd rather work 7 weeks of, hardship staying out than the rest of my life working without a contract. Because once you have no contract, you have no protection.
Henry, call. What does Henry say?
I joined the strike because it was very clear that the Hospital Governing Commission were trying to destroy the union. And it got to be real apparent that the only way to stop that was to make a real strong stand. I think it became very clear in this strike that nurses were together. In fact, they were so much together that from week 1 until week 5, there was barely a trickle of nurses who went back in the hospital. So beginning to understand very clearly that as administrative bureaucracy gets bigger and bigger and bigger, that patient care is left at the bottom of the list and that nursing is left at the bottom of the list. We're now a corporation instead of a hospital. And as a corporation, we nurses and doctors as workers have to begin to think that way, that we have to be able to make demands on the corporation and have those demands met. Today people understand that it's nice to be an angel of mercy, but if you have a family to feed, it's also nice to be able to feed your family. So you make a clear choice, and the choice is to be able to do good nursing care for the time that you're there, and then just make a decent salary and have decent benefits so that you can go home and also take care of your family and take care of yourself. Right now nurses are still trying to get over this whole professionalism thing of, is it professional to be on strike? Is it professional to ask for our rights? To get over that and to reach a point where we see ourselves simply as workers in the hospital takes a lot of education.
Nurses are organizing because they're coming to realize that the reality of working, is not that good, that we really are workers and we put up with horrendous conditions and things like that. So I think what we're seeing now is really an attempt to buy nurses up by kind of the lure of upward mobility. Some small number of nurses can get BS degrees, and those will be the ones who become head nurses. Or if it becomes too bad, you can go to a nurse practitioner program. And it's like putting this thing up here that we can become, so that as long as we see that maybe there's a chance that I can get out of nursing, I can become a nurse practitioner and go around and make home visits or do this or do that, then I'll put up with this stuff in the hospital long enough till I can get the next degree.
Medicine has simply viewed nursing as the lower, menial half of medicine. Doctors have always tried to involve nurses in medical functions that they want to discard.
Okay, say up. Have you ever had any discharge from your ears?
No.
Okay, if you'll take some deep breaths through your mouth, okay? Out.
As I've mentioned to you before, to communicate your certainty about what you found in the patient, you have to persuade, in a sense, the person that's listening that you really know your stuff. If you're not certain, be sure that you're not certain and say so in a very certain fashion.
Okay, physical exam. The chest was symmetrical. It was resonant to percussion in all fields. The breath sounds were normal.
I think when you do not have a proper image of yourself as somebody who's giving a service, then you're going to attach yourself to a group that does. Nurses are spending an extended amount of time learning to do physical exams, physical diagnosis, and who is this data for? It's for the physician, and I say that's fine. If the physician needs help, let him go train assistants, and if these nurses want to identify with physicians, then let them go get licensed as physician's assistants and get out of nursing and leave us in nursing alone to do nursing. Because they're distorting our image, they're eroding the whole autonomy of the profession. There's a lot of federal and public money being poured into these programs, and it is robbing the citizen and the public of needed nursing care, and all who's reaping the benefit is the physician. A physician with a nurse pediatric associate who's doing this kind of thing can increase his income from $50,000 a year to $100,000 a year and pay her $20,000.
Bring the rib. Right in there.
Medical care is not health care. Medical care is classically illness-oriented because of the definition of the practice of medicine, which is the diagnosis and treatment of pathology. And in fact, there's no money in health care. The money in the whole industrial complex is in illness care. Pharmaceuticals, supplies, hospitals, insurance, the whole business. We thought that the public should have access to nursing service when and where they want it. And we started a private practice in Stuyvesant Town, Peter Cooper area of New York. We see our own patients for nursing, and we see them in their home.
Hi, Rose.
Hi.
How are you?
Oh, I'm glad to see you. In nursing, we're dealing with the whole patient, the whole client, the whole individual in terms of their family, themselves, their environment. We're looking to see how we can help somebody make their life better.
How was your week?
My week? I don't have any belts. I lost my belts and I can't move around the way I used to.
You're not moving as well as you were when I saw you before, Rose?
No, I'm not. Because I go in there and get my breakfast, but I'm a little bit scared, you know. I'm shaky. I'm afraid I'm going to fall.
And it's particularly at, it's usually in the evening. Do you have that trouble when I'm not here?
No.
Well, then I was wondering whether it's me.
Is it better in the morning, Rose, or?
Yes, it is.
In the evening it's worse?
I see my right leg used to buckle a little bit. I don't know. I think it buckles under me. I feel like a sponge. The more I dry, wipe the...
For years, nurses, through the Visiting Nurse Associations, public health nurses, frontier nurses, have been providing care for people in their homes. Third-party payment, in other words, Blue Cross, Blue Shield, these kinds of things will not pay for nursing care in the home unless the patient's physician has authorized it. Why should you have to go pay a doctor $40 to get him to authorize that you have nursing care? In other words, they're two separate professions.
I don't know what I'd do without you.
You're a good woman, too.
Yeah.
See, the legislation in Congress determines where nurses work, how much they'll get paid, and what they'll do. The legislation has been written very, very specifically by a physician-oriented Congress. The healthcare delivery system in this country is chaotic. It's not delivering healthcare services. People are outraged because they lack access and because it costs too much.
I don't think we're ever going to have a healthcare system in this country until the public starts realizing where it's at and monitors it very carefully and takes the control for the system out of the hands of one dominating profession called medicine and out of the hands of groups like the American Hospital Association. Because who sits on the boards that play things like Blue Cross and Blue Shield? Physicians and hospital administrators. And who monitors whether the hospital is in fact working within a cost system. The very people that are running the institutions are doing the monitoring, and that's kind of fun.
In the next decade, nurses will need political skills just as surely as they need clinical and teaching skills. You will see far more struggle by nurses like there have been in Illinois in that strike, saying we demand not only a decent wage, but good patient care. That's what the San Francisco strike was all about, too. And I think you'll see nurses taking a far more aggressive role.
Thank you for coming out today for lunch hour. We have to get together with other people who share the same lousy working conditions and are interested in better health care. And that's the other people who work in the hospital and the patients. Together, we might be strong enough to make some of the changes that we need.